And now we turn to questions from the media. And first up today, from Isle of Man Television, I have Paul Moulton. And just before you ask your question, Paul, I believe congratulations may be in order. Was it your birthday yesterday, if I'm right?
Thank you. You were invited for a drink in our unsocial distancing area, but I didn't see you there. But
I obviously haven't seen the email.
Thank you for reminding me I'm 61.
It's somewhere in the backlog, but happy birthday, Paul.
Thank you very much. And it was the envy, actually. The pictures like that go around the world and people just come at you back going, wow, this is an amazing situation. You must be getting so much press as well. It's been quite a time for the Isle of Man, hasn't it?
It has indeed. I mean, the response globally to what the Isle of Man has been absolutely phenomenal. Media from all around the world. I think the Chief Minister today has been speaking to Austrian and Canadian media around the situation here in the island. So everyone on the island should be very proud of what they've achieved, and it's getting international recognition for our small community.
And I heard you on LBC, which is my station to listen to normally. Anyway, the question, Lancet had quite a big thing about the AstraZeneca COVID-19 dose rate, and it's sort of backing up what the UK is saying about actually making the pause between the first and the second dose longer is actually proving to be actually a useful thing to do. Your thoughts, because you did say there you may have points where you're going to be not getting the amount of vaccine you want in. Any sort of changes maybe having to be looked at if that is the case, knowing that this does work?
Well, I'll give the layman's view first of all, and then I'll pass to the Director of Public Health to give the professional view. From a layman's point of view, we assess all the evidence that's put before us. We continue to continually assess everything, including the new report that is out. There is evidence from this report that having the 12-week dose doesn't affect efficacy, but there has also been notes of caution sounded around it as well from certain scientists who've said that when you look at the samples that the report used, particularly around the age, the sex of the people involved and the ethnicity, it wasn't necessarily a full widespread sample, but it is looking positive. We will obviously review it as we always do. At the moment we are still sticking with the 21 days for the second dose, but if the clinical advice is that we should go longer than that, then that is what DHSC will follow. But I will pass you over to the Director of Public Health, who can give you a much more technical explanation than I can.
Yes, the Lancet paper is of course a preprint, which means it hasn't yet been peer reviewed, and clearly it needs that to really test the data and look at all the strengths and the limitations thereof, which often appear different to people who are not the research team that published than to the actual researchers. But in fact, the findings from that study do look extremely encouraging. They've followed up the same cohorts as were in the initial phase 3 trial, so it is full data, which is good, and it does certainly seem to indicate that efficacy is at least as good with a 12-week delay and maybe better. And there may be reasons for that based on what we know and what JCVI took into account when they made their original assessment, that we know from other vaccines that often a longer interval leads to better response than a shorter one. So that wouldn't actually be to be unexpected. The other thing that is extremely interesting out of that paper is that they not only followed up the original cohort on exactly the same basis as they had in the trial, which is to say that people either had the vaccine or the dummy vaccine, the control vaccine, which was actually a meningitis vaccine, and then those people were sort of let be, if you like, with the proviso that should they develop symptoms, they were to report and they were then tested. So the follow-up of those people depends on them developing symptoms. And that is the data that has shown us and has now confirmed that people who have the vaccine are protected from serious illness. However, what they have now done with the UK cohort that was in that trial, they actually not only waited for people to present with symptoms, they actually did weekly tests on everybody, regardless of whether or not they had symptoms. And that is the data that is showing strong indications that this vaccine actually prevents infection or reduces infection. And if it reduces infection, it will reduce transmission. So that's an extremely positive finding, which obviously we hope will be borne out in wider data and longer follow-up.
And 17,700 people a good amount of people do for this sort of testing, for data?
Yes. A phase 3 trial will have had a lot of statistical analysis to determine the sample size. There are some statistical techniques you use to show how many you need in your sample in order to show a valid result. So it will all have been calculated before the protocol was even agreed and the trial started.
Right. Another question is about mixing and matching of the vaccines now. That seems to be coming back into the potential ideas that you don't need to keep with the same one. We doing what? And what will your thoughts be on this?
Well, again, I'll hand over to Director of Public Health in a moment for the more technical answer. We are sticking with giving people the second dose of the same vaccine they've had. It's very early days in the trials that they're undertaking in the UK. They've literally just started the trials to see what the effect is of mixing and matching. We believe at the moment the safest and best point of view from a clinical point of view is to keep to the same vaccine that people have had. The trial data may show different when it comes out, but as with everything in this pandemic, that takes time to come through, and it may be a substantial amount of time yet till we have formal evidence on that, and I'll hand over to Dr. Ewart.
Yes, the Minister is absolutely right. We're certainly not at the point of moving to any change in that direction ourselves. The vaccines are not currently authorised for that mixing and matching, and the evidence for them is not there. Interestingly, there are really two reasons why this is of interest. One is to actually help with supply issues, because if you're not constrained by having to have the second dose of exactly the same, you can be more flexible in how you use your vaccine and roll out your programme. So that's one thing, and obviously in the face of a pandemic that's quite important. But the other thing is that there are actually some quite strong theoretical reasons why you might get a better response, better efficacy from a mix and match approach. But that is hypothetical at the moment and needs to be tested with the data. So exactly as the Minister says, we need to wait for those studies to be done.